The question is, which of the following does not represent a facial space for the spread of infection? Superficial temporal space, pterygomandibular space, mesenteric space, rhinoceroteric space, submental space. See, all the spaces are prone for spread of infection, but there is no space called rhinoceroteric space. So the wrong answer, does not represent the facial space, is rhinoceroteric space. D is the answer. Which of the following classification of impacted teeth must always involve both bone removal and sectioning during the surgical procedure? So we have to say which type of impaction needs both bone removal and sectioning. That is the question. Mesioangular impaction, horizontal impaction, vertical impaction, A and B, A, B and C. See, when you have a mesioangular case, even without sectioning, we can remove, because if it's not involving the ramus of the mandible so much, the sectioning is not more needed. Sectioning of the tooth is not needed. Only the bone removal is more than enough to remove the mesioangular impacted case. A horizontal, you need to section the tooth. That is one thing. Vertical, maybe it may or may not need sectioning, but bone removal is more than enough for vertical impaction in certain cases. So the answer is B. Horizontal impaction needs both bone removal and sectioning. Because D involves A and B. A is not the answer, so we can't say it is D. E also A, B and C. So that is also not the correct answer. So the answer is B, vertical impaction. Which of the following does not represent a possible finding of severe infection? Trismus, drooling, difficult or painful swallowing, swelling and induration with the elevation of the tongue, temperature of 99 degree Fahrenheit. So the answer is mostly temperature of 99 degree Fahrenheit, because unless and until a patient is immunocompromised, the temperature will not shoot up with mostly in an infection. Does not represent a possible finding of severe infection. So if a patient is immunocompromised, then the fever, temperature may rise. Otherwise, the other options, trismus, drooling, painful swallowing, swelling and induration, will be present in severe infection irrespective of the systemic condition. But if you want the temperature to be raised to such an extent, it should be immunocompromised. So the answer is temperature of 99 degree Fahrenheit. You are performing a 5-year follow-up on a 43-year-old patient with an implant. When comparing the radiographs, you estimate that there has been almost 0.1 mm loss of bone height around the implant since it was placed. Which of the following is indicated? Removal of implant and replacement with a larger size implant, removal of implant to allow healing before another one can be placed 4 months later, remaking the prosthetic crown because of tangible force on the implant. The implant is doing well, the amount of bone loss is considered acceptable. So the question is, it's a 5-year follow-up, patient, 43-year-old patient, implant was placed 5 years back. They are saying the radiograph shows 0.1 mm. So after 5 years, it's 0.1 mm vertical bone loss. For this question, we have to know how much of vertical bone loss can be considered acceptable. So according to the literature, it is about 0.02 mm per year annually. If the bone loss is there, it's acceptable. No need to remove the implant or replace the implant or to change the prosthetic crown unless and until it's more than 0.02 mm annually. You need not worry about it. In this case, it's a 5-year follow-up. So if you multiply 0.02 into 5, it comes 0.1 mm. So for 5 years, 0.1 mm is acceptable. So the answer is the implant is doing well. This amount of bone loss is considered acceptable. Before going to the next question, kindly subscribe to our channel. And the 5th question is, on evaluation of immediate post-operative panoramic film of a dental implant placing tooth 30, you measure a distance of 1.5 mm from the apex of the implant to the infraalveolar nerve canal. This is a titanium implant in another otherwise healthy patient. Which of the following action is indicated? So if you read the question again, it says it's an immediate post-operative radiograph taken for a implant which has been placed in the tooth numbers site is 30. So from the tip of the implant to the inferior alveolar canal, the distance is 1.5 mm. So they are asking what is the action it will be taken. In addition, they are saying it's an otherwise healthy patient. So the options are: proceed with an immediate loading of implant, continue but perform a two-stage procedure only, back the implant out in approximately 0.5 mm to ensure a safe distance from the nerve, remove the implant and plan a repeat surgery after 4 months of healing. So for this, you have to know how much of distance the implant should be there from the vital structure. There is a video which I have posted regarding the implant and its distance from the vital structure. You can watch that. So from the inferior alveolar nerve canal, it should be 2 mm, but in this case it's 1.5 mm. So 0.5 mm we have to leave even more. So the answer would be back the implant out 0.5 mm to ensure the safe distance of 2 mm from the inferior alveolar canal. The C is the answer. Okay, it's no need to do a reimplantation after 4 months or no need to continue a two-stage procedure, because it's an immediate post-operative film taken. So you can do it now itself. And also immediate loading should not be given, because ideally it should be 2 mm from the, at least 2 mm from the inferior alveolar canal. So A is not the answer. So the answer is C. Okay. Next question is, which of the following statement regarding Carey's risk assessment is true? So it's regarding Carey's risk assessment. True. Which is true, they are asking. The presence of restoration is a good indicator of current Carey's activity. See, if it is restoration, it only says about the past Carey's activity, not the current status activity. So it's wrong. The presence of restoration is a good indicator of past Carey's activity. Yeah, that is correct, because the restoration will say that the person has suffered from caries in the past. So it's a good indicator of past caries activity. So it is correct. The presence of plaque film is a good indicator of current caries activity. Plaque biofilm will be mostly related to the gingival and periodontal disease, not the caries activity. So C is wrong. D. The presence of pit and fissure sealant is a good indicator of current caries activity. Pit and fissure sealant, if the patient is having, it shows that the patient is so concerned about the dental issues, and they have done a preventive procedure. It's not a primary treatment, rather they have done a preventive procedure, pit and fissure. So it's not an indicator of current caries activity. So D is wrong. So the B, presence of restoration is a good indicator of past caries activity, is the right answer. Next question. Which of the following statement about indirect pulp cap is false? They are asking which is wrong about indirect pulp capping. Some leathery caries may be left in the preparation. Yes, since it is very close, sometimes in indirect pulp capping we leave some leathery caries. Then a liner is generally recommended in excavation. Definitely liner should be placed for indirect pulp capping. That is also correct. The operator should wait at least 6 to 8 weeks before re-entry. So that is also correct. After indirect pulp capping, we need to wait for 6 to 8 weeks. So the question is about false. Which is false about indirect pulp capping? D is the prognosis of the indirect pulp capping treatment is poorer than the direct pulp capping. Actually, it is just a reverse. The prognosis of direct pulp capping is poorer than indirect pulp capping. So the D is the wrong answer. The D, which is statement, is wrong. So the correct answer for second question is D. The prognosis of indirect pulp cap treatment is poorer than direct pulp cap treatment. That statement is wrong. Okay. Hope you are liking it. We'll go to the next question. Smooth surface caries refers to facial and lingual surface, occlusal pit and grooves, mesial and distal surface, A and C. Smooth surface means it doesn't include occlusal pit and groove, so B is excluded. Okay, so rest of the thing you just think facial, lingual, yes, it's smooth. Mesial and distal also called as smooth surface caries only. So the answer is A and C. So the answer is D, A and C. Okay. Next question. The use of the rubber dam is best indicated for adhesive procedures, quadrant dentistry, teeth with challenging preparation, difficult patients, all the above. Rubber dam has to be done in all the conservative and endodontic procedure as much as possible. So the answer is all the above, whatever may be the treatment. Okay. In addition, it gives you a clearer view, and the field would be clear when you work. So the answer is all the above. For the dental hand instrument with a formula of 10, 8.5, 8, 14, the number 10 refers to. So we have to know the formula. The first digit always indicates the width of the blade in tens of a millimeter. Then the second digit indicates the primary cutting edge angle in centigrades, and the third indicates the blade length in millimeters, and the fourth digit indicates the blade angle in centigrades. So the question is, what does the number 10 refers? It is the first digit. So the answer is width of the blade in tens of a millimeter. Wow, we have completed 10 MCQs, done and dusted. So if you want to see further videos, kindly click this link and subscribe to the channel Dental Shots for the further notification of new videos. And have a great day. God bless you all. And don't forget to leave a comment for me about this video. What are the upgradation you need and what MCQs you need? Kindly comment below. Thank you.